activated a code stroke. I was told by my boss that I need to go ahead and change the time because the patient has been in the department for such and such time. I'm like, I don't really understand what you're saying. I really can't understand what you're saying, because this is the time that I am seeing the patient. This is the time I'm seeing the patient. So this is the time that I'm documenting for. I don't care about the patient being in the department for the last 1 hour and 15 minutes and nobody never see the stroke and nobody never activated it. This is a time that I saw the patient, and this is a time I am covering for. And there was something big about it, because code stroke make much money. It look bad for the hospital when you have a hospital that is like a stroke hospital, or a stroke center, or a chest pain center, and all of those things that you're supposed to be dotting your I's and crossing your T's are not looking good on paper. And so now the hospital going to look a little bit bad, in a sense. You understand? Because for 1 hour this patient was having a stroke and nobody realized in the department after the patient was checked in. So a lot of times you'll hear persons talking about that they're quitting their nursing job, and we really don't know the different reasons. A lot of times they'll talk about the hospital this, the hospital that, or sometimes they'll hear about toxic work environment. And there are so many different reasons why, they went about and sending their resignation, because a lot of time it doesn't align with their professional as well as their personal well-being, let's just say. And so I'm going to talk to you regarding 10 reasons why quitting your job should not be a problem. So if you do quit your job, you shouldn't feel like you have any regrets about doing it, because it is something that you stand firmly for. If you have a subscriber to the channel, I would love for you to go ahead and subscribe, like, share, turn that notification bell on, and remember to hit the thumbs up button and subscribe to the channel if you haven't done so as yet. All right, one thing about any job that you're in, you must always remember that you're not stuck. Don't feel as though you're stuck in that one job. You're not a furniture, you're not a wall, you can actually move. So when you accept a job at the initial phase of your nursing career, don't feel as though you're stuck in that one position or that one area of nursing, because nursing is so broad. There is so much opportunities out there that you can venture into, and that is one thing that a lot of persons love about the nursing field. You don't have to be stuck at the bedside. You can always go into home health. You can always go into home care, public health. You can always go into research. There's so many different areas that persons can venture into. So don't feel as though you're stuck in that area, because there's so much opportunities that are outside of bedside hospital care that you can always seek out. When it comes down to your work, you want to ensure that you are functioning at the highest capacity. And so yes, it's always good to take your work serious, but at the same time you need to remember that you need peace of mind. You need peace of mind when it comes on to your work. So if you're not getting that at your workplace, just pick up your things and go. Leave in a professional manner, because it's not aligning with your mental health. All right, it's not aligning with your personal goal. And in terms of your health, if you're not able to take care of yourself, if you're not taking care of yourself first, you're not going to be able to take care of other persons at your highest ability. Toxic environment. Don't let it be a case where a toxic environment is like a badge of honor for you. It is not. Don't look at it as a badge of honor. So if you realize that the environment is hostile, you're not getting the support that you need, the environment is not making you any stronger in terms of your abilities and skills, just walk away from it. You understand? Don't let it be a case where that environment breaks you and slows it down and you don't reach your goal. You understand? In life, all of us, we do have certain goals that we're striving for, we're trying to accomplish in life. And sometimes when you're in a toxic environment, it demotivates you, and that is something that you don't want. You want to be in an environment that is uplifting for you. You understand? So if you realize that that's the environment that you're in and it's not working for you, it's not working out in your favor, it's a case where you're in that environment and you don't know how to deal with it, and you're just working along with it because that is just the flow of the department or the hospital. So if you realize you're working in an environment, a workspace, a hospital, a community, wherever it is that you're working and the environment is just so toxic, you need to pick up your things and go, because you don't want that toxicity to spill over to a point where you become burned out because of everything that is going on. You understand? Because emotionally and mentally you can become so drained, and that can lead to a mental breakdown as well. All right, another thing definitely is when it comes on to burnout, if you feel as though you're at a point where you're heading into burnout, or you feel as though you're burned out, now is the time to go ahead and quit that job, because burnout is very real. A lot of us as nurses, we go above and beyond to make patients and their relatives, hospital, look good, feel better, and the care is exceptional. But nobody is understanding that a lot of us as nurses, we exert ourselves a lot of time. We put ourselves under stressful situations, conditions, to make sure that everybody is happy, to make sure that everybody is well taken care of, and we forget about ourselves. And in turn, what happens is that we find ourselves feeling exhausted, overwhelmed, overworked. You understand? And all of that is leading up to burnout. So if you're in a situation where you see that this is what you're experiencing, this is how you're feeling, don't let it be a case where you're suffering and you're not taking the necessary step for self-recovery. So go ahead, walk away from the job professionally, because your mental health, your physical health, your emotional health, all different health you can think about comes first. You understand? So if it means that you need to walk away, go ahead and quit your job, resign your job in a professional manner to maintain or ensure that your health is sustained. All right, because if you're not healthy, there's no way you can actually bring across anything to anybody. Because you can imagine, I am telling a person, go ahead and do this, and I am like very big because I'm not exercising, I'm not eating properly, I'm eating a lot of fast food. Nobody's gonna want to listen to you. You understand? Because they're thinking that you are providing that information to them, but you're not practicing it. Because we're practicing what we're preaching, and sometimes we're really guilty of that as well. So this message is also for me. All right, this message is also for me. Another thing that definitely we need to address is when you outgrow a role. I've seen where persons have served in a position for decades, years. They're doing the same thing over and over and over and over, and they just feel as though that position no longer suits them or serves them. So they want to upgrade themselves. They want to do something. They want to seek out something a little bit different from what they've been doing over the last 10 years in their career. And so if you are at a point where that is just how you're feeling, then definitely it's always good to go ahead and quit. You understand? It's always good to go ahead and change. Find something else that will suit you. All right? Find something else that will suit you, and that shouldn't be a problem either. Another thing is, when you realize that your reputation is at risk, go ahead and quit. Go ahead and resign. You understand? Or if your nursing license is at risk, go ahead and resign. And I'm going to break it up in two sections, because a lot of times, they go hand in hand. But a lot of times, especially as nurses, because we know that we definitely need the job to pay our expenses, we need it to pay the bills, send our kids to school, buy the groceries, pay the mortgage, and all of those things. We feel as though a lot of times when hospitals or companies do certain things, even when we're not in agreement with it all the time, we're supposed to be accepting it, because guess what? The bigger head said that. You understand? If the bigger head say go ahead and lie, we're gonna go ahead and lie. And I'm gonna tell you about a story where I was at this hospital working, and there was a patient that was placed in one of my rooms. So I went down for the 9 o'clock shift in the morning, so it's supposed to be a mid shift. I went down for that shift in the morning, and at that time they placed 4 patients in my room. They have this thing where they call it like direct bed, which is not right, because nobody is looking at the patient at that time to see exactly what is going on, or at least that was supposed to be done. They're supposed to be looking at the patient to make sure that the patient is safe, the symptoms of the patient is okay for the patient to go back and wait for a nurse. But rather than doing that, what is being done by the triage nurse at that time is that they take 4 patients and they put them in 1, 2, 3, 4 rooms. And when you come on at 9 o'clock, you're supposed to go in and be superwoman and see all of the patients at once. So when I went in, I got 4 patients. But the first patient that I eyeballed, that patient was very sweaty, clammy, because I wasn't thinking that somebody in their rightful mind would put 4 new patients into a room and not even ask the patients basic questions or even to say get some vital signs on the patient until I am able to settle the patient. So I went in the first room, and that patient, there was a big language barrier, and so I went ahead, asked a few questions, couldn't get anything. While I'm there riding and whistling, I'm trying to get an IV, calling for a code because this guy was like, you know, crashing out. Lo and behold, we weren't able to get anything. We were able to do a troponin because there was one poke that I did. I was able to get a small amount of blood, so I went ahead and did a troponin on the patient. This patient's troponin was in the thousands. And so we were able to take the patient to the cath lab and stent the patient. While I'm there, all of this going on, I never know that there was a patient who was having stroke in one of my room. And when I was finished doing everything, got back from the cath lab, because I was over there for a long time because the patient coded, we had to resuscitate the patient, and there was just a bunch of things going on. So while I was there with that patient, as I say, I never know that there was another patient in my room that had stroke-like symptoms. So after I got back, this was probably like an hour later, I don't know what was happening, why nobody had looked into my rooms to see that I wasn't there, or the information wasn't passed on to say that, oh, Stacy is over by cath lab with a patient who coded, blah blah blah. So I came back and realized that this patient had facial droop and numbness and tingling sensation to like the left side. It was at that time I was told no by my boss that I need to go ahead, and so after I activated a code stroke, I was told by my boss that I need to go ahead and change the time because the patient has been in the department for such and such time. I'm like, I don't really understand what you're saying. I really can't understand what you're saying, because this is the time that I am seeing the patient. This is the time I'm seeing the patient. So this is the time that I'm documenting for. I don't care about the patient being in the department for the last 1 hour and 15 minutes and nobody never see the stroke and nobody never activated it. This is a time that I saw the patient, and this is a time I am covering for. And there was something big about it because, you know, code stroke make much money. You know, it look bad for the hospital when you have a hospital that is like a stroke hospital, or a stroke center, or a chest pain center, and all of those things that you're supposed to be dotting your I's and crossing your T's are not looking good on paper. And so now the hospital going to look a little bit bad in a sense, you understand, because for 1 hour this patient was having a stroke and nobody realized in the department after the patient was checked in. So I was there, and I said to them that I'm not back timing anything. I'm not back timing anything because, as I say, that is just unfair. You're gonna tell me now to go ahead and make a change to something that no go so in a right, it wrong, and then no, you're gonna put my license at risk, because if something do happen, you're gonna hear that Stacy had the patient from this time to this time and did not realize that the patient had a stroke. And then, you know, sometimes things do happen and we don't realize. Some things do happen and we don't realize years later on, you know, when somebody look at it and say, oh, but Stacy did mess up at that time. And so let me send out a lawsuit. Let me send out some paperwork to this lady because this one is responsible for. You understand, the complications or the death arising because of this stroke that was missed. And so I was like, no, I'm not doing that. I am not doing it. You understand? Somebody else went ahead and did whatever. And I went over to the person and said, no, you're not supposed to do that. This is a time that you saw the person. Not because management says whatever. Management can go ahead and put their information on the paper to say that this is the time that they saw the patient, even though it never goes so. You understand? Because for this one little payout for the stroke, this one little payout for whatever workup we're going to do on this patient, yes, it may be okay now, but it's just been dishonest. It's a lie. We never saw the patient at that time. So you can go ahead and put your name on that paper, but I'm not putting my name on that stroke workup for that patient. And it was after that time I'm like, I realized this was a trend, but change in time because they want to have the perfect time period for certain things. They want to make sure that the 10 minutes time period is being met for the EKG. They want to make sure that the 10 minutes is met for the CT scan. They want to make sure that the 10 minutes, like there are so many things that we go ahead and we back time just because we want to make sure that hospital is good. I have a lot of nurses who are doing all of these things and not thinking about the implications that can arise because of doing something like this without even thinking about it. Yes, it's 1 little time, but 1 little time makes a big difference. 1 little time can make a very big difference in healthcare or in nursing care. So at that time, I went ahead a little bit after. I'm just sending my little resignation. Me no bother renew no more contract with them because I said, no sir, this don't make no sense. This is what you're wanting so you can have wait time in the emergency room of 0 minutes. So we misled people by lying on multiple occasions on different things. And that was just not something that I was in agreement with. You understand? My reputation would be tarnished if I go ahead and write something that never goes so. You understand? And so in situations like that, go ahead and send out your resignation. Don't feel bad about it. You're protecting your license and you're protecting your name. You're protecting your brand. And even though you might not be a brand like, you know, Louis Vuitton and, you know, all them little fancy name there on TV, you know, that we're talking about because, you know, the price of the goods cost this amount, but we're selling it for an arm and a leg or $1 million. Definitely, you are a brand and you represent yourself. So make sure that whatever you're doing it correctly, you're doing it right. You understand? Because it speaks highly about you when you do things like that. All right. So and that's the same thing when it comes on to your license. Both of them go hand in hand. Don't let anybody play around with another license and make you feel as though you speaking up for yourself is something wrong. It's not wrong. Speak up about your license because you worked so hard for your license. Nobody was there at the time when you were studying, you know, when you never had the scrubs to put on or the uniform to put on, the stocking to put on, the shoes to put on. You know, nobody was there to give you a lending hand to say, okay, then you need lunch money. Here is the lunch money for this week, or this is the tuition. So don't let it be a case where you go out there and make some silly mistake just because the bigger management said that, or the bigger boss said that, or my emergency room director said that. Or don't let it be a case where they say it's okay to do it. Yeah, it's okay to do it until you get catch. You understand? It's okay for you to do it until you get catch. Whenever you're being caught, you're going to be there by yourself. So whatever you're doing, practice it and do it the correct way. Protect your license, protect your reputation, and practice with integrity and always be professional with what you're doing. All right? Because may I tell you, this environment, this kind of working environment, this kind of health industry, yeah man, if you're not strong, it will kill you, literally kill you. All right? You are more than your job. All right? You are more than your job. Don't let anyone's job define you, because it shouldn't be like that. All right? Don't let anyone's job define you. There's no single job out there that will serve its full purpose in your life or is worth it that you give up everything else, you know, your mental well-being, physical well-being, because of that job. All right? There's no one job that will dictate your future. So don't feel as though you're stuck in that job and there is no way out. Always go ahead and explore. And as I said, nursing is very, very broad. There's so many opportunities out there for Tom, Dick, and Harry, for you. You understand? That you can explore and see whether or not this is something that you really enjoy, or this is something that you want to do full time for a long time. All right? So I do hope that these tips were very beneficial. And if you have any concerns, as usual, go ahead and leave it in the comment box below. And if you do want to add something, the comment box is there as well. Just leave it and we can interact on the topic as we go along. Until then, I will see you in the next video. And I do hope you will have a wonderful day, or whenever you see this video, day, night, noon, yeah, whenever you see the video, have a wonderful day. Okay, until then, bye.